over some of the work we've been doing around trauma-informed approaches and principles. So over to you, Karen.
Okay, thanks, Emma. And I apologise, I'm aware I'm being recorded and I've got a very loud toddler downstairs, but living in a very small cottage means you hear everything, so I apologise. So I wanted to talk to you today about trauma-informed insights in the context of COVID-19. And because I wasn't exactly aware what everyone's knowledge in this group was, I wanted to start the conversation with some definitions. And I think, probably, hearing about, obviously in constant movement, looking for kind of national guidance, especially as we go into this second lockdown, it's really about how we navigate that with a kind of trauma-informed, compassionate approach is really what I'm trying to think about here. So yeah, next slide, unless I have control. So yeah, some definitions just to start with. So I'm aware that some of you might be more aware of this than others, but essentially when we talk about trauma in this context, we're talking about when a person experiences or witnesses any physically or emotionally harmful or life-threatening event. So this can just be a single one-off traumatic event, or it can be something that's prolonged or repeated for a considerable amount of time in some cases. When we talk about then trauma-informed is about us being informed of the trauma, so knowing that trauma does exist in the communities and our populations, and its wide-ranging effects on the individuals, but also families, communities, and wider society. And then it's doing something about that, which is essentially what the trauma responsive is. It's about what actions we do with that knowledge. So what policies, what practices, what environment we create in making sure that we prevent and mitigate any trauma that is experienced. Next slide, please. So when we talk about trauma, most of the literature focuses on these adverse childhood experiences, and by this it's kind of a narrow definition, and we'll come on to that later, but essentially it's talking about direct abuse, so that's sexual, emotional, physical, and neglect, and then it talks about indirect abuse, so household dysfunction, so breaking up of a home, a relationship, domestic violence, drug and alcohol misuse, any mental health, any criminality, or children who live in care. So they're the kind of 10 kind of core kind of adverse childhood experiences, kind of seen as the core trauma episodes. But as we know, it's much more broad than that. And homelessness, as we'll come on to, is being one of those, plus perhaps any of these other things going on as well. What's interesting about this research as well is that approximately half of the English population have been found to experience one or more ACEs. This does vary across the type of ACEs, and as we'll come on to, you can experience an ACE and have other resilience and supportive factors to be okay. Next slide, please. So why is this important? From a public health perspective, sorry, I should have said I'm public health registrar at Public Health England South East. So for us, it was particularly thinking about the health impacts. So what we can see is those who have 4 or more ACEs compared to those who don't have any ACEs. There's some examples here of kind of health behaviours, but increased likely to smoke, teenage pregnancy, binge drinking. They're more likely to be a victim and also a perpetrator of violence, more likely to be incarcerated. There's a wealth of things, making the case essentially to prevent any adverse childhood experiences or trauma, but if it does happen, putting in quick and supportive action and a trauma-informed approach is part of that approach to support and prevent any of these further adverse outcomes. So the next slide just gives one more definition, and that is around resilience. So as we said, if we think about 50% of our population has experienced just the adverse childhood experiences, let alone other traumatic events, you can overcome a traumatic event or adversity with resilience to avoid any damaging effects. And this can be seen at an individual level, so having good self-esteem, self-efficacy, a positive outlook, a sense of control. can all help in preventing any adverse impacts. At the family level, this is about having a strong parent-child relationships, having a supportive family, the wider family cohesion, and then the wider community, having a supportive community, school environment, workplace, having friendships, relationships, peer networks can all help navigate any adversity or trauma. So then on the next, in the context of homelessness, I'm aware a lot of this I'm preaching to the converted, but I just wanted to kind of give it that context around homelessness and trauma. So homelessness is traumatic. It is a trauma episode. People experiencing homelessness often live with a multitude of challenges, some of which we've already talked about, mental health being one of them. So it's a sudden loss of home and, changing to that differing home environment. Some also have a history of trauma, sometimes long histories of trauma. There's been literature to show that 93% of adult females experiencing homelessness have experienced trauma, and this often includes sexual, psychological, or physical abuse. Most families who are experiencing homelessness are often headed by a single woman, and these women are often experiencing post-traumatic stress disorder, depression, substance misuse at higher rates than we see in the general population. And then more broadly, people experiencing homelessness are often marginalised, isolated, and discriminated against, and so are highly vulnerable to violence and victimisation. Long-term homelessness, so this is normally defined, well, you probably know, but in this literature it's over 30 months. What they're finding is if people are homeless more than 30 months, it's normally attributed to a trauma episode earlier on. So I guess I'm just trying to, highlight the fact that trauma episodes often, go hand in hand, unfortunately, with homelessness. It might be one or multitude, and addressing that with a trauma-informed approach, which we'll come on to, can really help to support and these people in society and make their way through. And that's where it comes in our systems and our organisations, ensuring that we don't re-traumatise as part of this process. So the next slide is really from the Substance Misuse, Mental Health Services Administration in the US, so kind of the leaders around this kind of trauma-informed approach more broadly. And the key thing really around this is around their 6 key principles that they talk about and how we work as organisations and systems in working with populations where trauma might be there. So it's fundamentally making sure our services are safe for both our service users and our staff, physically and psychologically. Making sure any of our processes, operations, decisions are all done with transparency, and that the goal is always to achieve trust with our service users. Peer support, so really using people who've experienced trauma and homelessness and other factors, so that can be peer-led and supported in that recovery and healing. Working in collaboration and mutuality, so having complete shared power across the system, making sure our service users have that power and that voice and are heard as part of that shared decision. And this goes in with empowerment, voice and trust, so shared decision-making, promoting self-advocacy, and making sure that all of this is done with cultural sensitivity, gender sensitivity and historical sensitivity, really understanding our different populations and the racial, ethnic and cultural needs across the system. So that's really about systemic and structural, as well as that individual change in how we work. Obviously, I think, these slides will be circulated so you can navigate this in more detail. So the next slide, COVID. So very much part of, so this is a task and finish group done with a variety of colleagues across the South East, so public health colleagues, as well as NHS England and Department for Education and Health Education England colleagues, as well as academics and other interested parties in the South East. So this has really been done in collaboration with them, and I thank them all for supporting with this. COVID was very much recognised as being yet another traumatic event. So for many of us, will have experienced, some sort of stress or trauma as part of this, but obviously our more vulnerable populations will have been disproportionately affected. So that's those who've had the disease. We now know that our BAME communities are more vulnerable and have a disproportionate loss of life. We know our shielding population have had to isolate for a lot longer and be a lot more isolated from society and much more vulnerable to loneliness and other factors, fertility, that come with that. And we know that our more vulnerable children, adults and families before locked in the home or reduced social contact may be more vulnerable to experiencing abuse or conflict. And then we have our economic challenges that are probably going to become more prevalent as we go forward, unfortunately, around loss of jobs and homes. So there's a huge, unfortunate opportunities for trauma with COVID and the current pandemic that we're in. And at the time that we tried to support the system, it was particularly at the time when schools and workplaces were returning prior to the previous lockdown. And thinking about that time, it was very much about, the priority was about preventing the spread of COVID and infection prevention control measures, social distancing, and sometimes quite inhumane kind of ways of working. And it was really important that as we go forward that we apply this trauma-informed approach as we do recover, and particularly for those services that had stopped, to do that in a trauma-informed way. So the next slide talks about what this means in the COVID context. And there's two big pieces of evidence that have kind of come out really advocating for a trauma-informed response to protect public mental health, well-being, and further trauma and health. And it kind of builds on the SAMHSA principles that we've already talked through, really making sure our policies, strategies, practices from prevention and mitigation, really focusing on our disadvantaged communities, and making sure that we have patience, compassion, empathy as we do recover. And I always think of this network because I think you've done some fantastic things during this time, in housing your homeless communities. And I think, as we do recover, I think it is about adapting to new ways of living, but restoring and rebuilding, this better environment. What are the real positives from this time, and how do we take that forward? And it sounds like, just from hearing Marie earlier, there's real passion to kind of take that forward going forward, which is good to hear. And so a trauma-informed approach is just one part of that approach to the COVID response and recovery. And it really is about recognising the COVID trauma, the other traumas that exist, and building forward in a more empathetic way. So the final slide really to talk through today is just what we did as a task and finish group in the South East around creating some trauma-informed principles in the context of COVID. So building on the 6 ones from SAMHSA to 10, and really thinking more broadly, so hopefully of use to this group as well as other populations and organisations across the system. So the first one was about first of all, being aware of the impact of adversity and the impacts from trauma, and how this can affect different people, so children, young people, adults, families. The second then is that really understanding what trauma is and championing that across the system, so from our leaders to our frontline workers, including how to assess needs in individual people with sensitivity, compassion, and not re-traumatizing. The third is really building a preventive approach, so recognising that trauma does exist, but trying to put in efforts to prevent that, and that includes the economic, so loss of jobs, loss of homes, to prevent any further trauma. Having an environment that supports resilience, so really thinking about that self-efficacy, that self-esteem, building up those life skills so that people can cope should they experience trauma or adversity. 5, being culturally informed, responsive, so that's really about those gender, those ethnic, those cultural things to think about when we change our structural and systemic responses to trauma. 6, providing time and safe spaces to develop trusting and supportive relationships. 7, having these clear pathways and making sure we do have that specialist support, but also working with our other system partners. So here, mental health, alcohol and substance misuse, so that we have that collaborative approach. 8, having strength-based, person-centered care, really making them be involved in making those decisions and strategies, resilience building. having 9 collaborative working with our communities and service users, and then 10, the building and reflective practice is very much about that safe space for our staff to reflect on their own experiences in helping people with trauma, and making sure there's no secondary trauma in our staff. So that, I guess, is probably the main bit of the presentation. The next slide is just to let you know that we do have a South East Adverse Childhood Experiences Trauma-Informed Network for those who are interested. And then the final slide has just got some useful links that you might find useful. So happy to take any questions or comments.
Thanks, Karen. That's really helpful. I think we've got a huge amount of